Hello, everybody. I am Dr. David Amron, and welcome to another episode of the Lippy Logic Webinar series. And so we've had a lot of great achievements in the last year. So June is Lipedema Awareness Month, and I've said we're still in June, which means it's still Lipedema Awareness Month. And since the last one that we've had a lot of great achievements. We began the series, the Lippy Logic Webinar series. I released my book in the last year. We've been to a lot of great conferences educationally. And what else would I want to say? Oh, and Karen Herbst, right? Karen Herbst joined us very recently, which is so fantastic. And we've joined forces and are really advancing the field, becoming more comprehensive with our diagnostic and preventative center, and are going to get involved in a lot more research. So we're going to cover a lot, and we've covered a lot in these webinar series. And these series are really educational, covering a lot of interesting topics. And this session is going to last an hour. The first part of it, we're going to cover material. And then the last part of it, we're going to field questions that have been submitted and talk about them. Today, I'm joined by my patient ambassadors, but really, I'm going to give a different term to them. They're more than just ambassadors. They're more than just social media influencers. Social media is something that, we all love and appreciate in many ways. I've struggled myself to accept it in a lot of different ways. My children many times are on it a little too frequently, so I have my feelings about it. And it can do a lot of there can be a lot of wasted time on it, but it can also do a lot of good too. And a lot of influencers are really influencing people in very positive directions. But I'm going to change the term for these three ladies, because I don't look at them as being just influencers, but really luminaries. And I really feel that way. They really are shedding the light and increasing awareness in such important ways. And I'm so grateful to have them on today and to talk with them. And they're very, they've got a lot to say. So it's going to be a very dynamic exchange of ideas. So I want to introduce, first of all, Allison Jacobs. And Allison is a fantastic dancer and a influencer on social media and is involved in lipedema awareness. And Kasey Potts is a lifestyle expert and a host of the podcast Millennial Mom. And she leads a nonprofit organization, which I didn't actually know about this, called Beyond Lipedema, right, Kasey?
Yes. Just kicked off this June.
Right. And Allison is a co-host of Lipedema Mamas. And they've recently released a course, again, which I didn't know this until recently, to navigate lipedema, called Conservative Management of Lipedema.
That's Ashley.
I'm sorry, say it again?
You said that I was the co-host. Ashley's the co-host.
I don't think so. Did I say you're the co-host?
Yeah, you said Allison. It's fine.
It's fine.
Okay. You guys keep me in line already. It's a little bit early in the morning. We had a little dinner party last night, my wife and I didn't really sleep that well. So it's Saturday. So we'll try to get together here. So let me just introduce myself. I think, hopefully most of you tuning in know who I am. I'm Dr. David Amron. I'm the founder and the medical director of the Roxbury Institute, with locations now in Los Angeles, California, where I am right now. And it's a beautiful day. I think finally we've broken into summer. That May gray and June gloom is gone. We opened up Salt Lake City, Utah, where I was on Thursday doing surgeries all day in the last year. And very recently, we opened up Arizona, headed by Dr. Karen Herbst, which is a diagnostic and preventative center there. And as many of you know, I'm very experienced with lipedema. I've been involved in it for over 25 years, certainly thousands of surgeries. I've got a great book out there. But this is not really about me, this segment. I want to talk with these wonderful women about lipedema, about increasing awareness, and hear what they have to say. So why don't each of you, Kasey, maybe you can start first, talk about your own personal journey with lipedema for a few minutes.
Sure. I mean, lipedema is only a term that I've learned since March of 23. And I mean, I am someone who was I can remember around 5th grade or so, being called thunder thighs because my body just didn't look like the other girls in class. And decades worth of diets, exercises that never worked, trying to figure out what this was. And then in March of 23, I was working with a dietitian. I was working out 6 times a week, eating 1,200 calories a day. and on a semaglutide injection. And over the course of those first 3 months, I only lost 8 pounds. And my dietitian was like, there is something else going on here. I don't know what it is, but I'm going to bring it to my peers to review. And one of her colleagues happened to have lipedema. And she said, you know what? Your client kind of sounds like she might have lipedema. I have it. And I think that you should ask her this list of symptoms. And that started the Google rabbit hole. And I was like, these arms and these legs look like mine. I found a specialist in Santa Monica. Within 30 seconds of being in her office fully clothed, I had my lipedema diagnosis, and it's just changed my life since then.
Was that Emily Eicher that you saw in Santa Monica?
Yeah, with Dr. Eicher.
Right, she's great. Actually, we had her as a guest a couple months ago on this, and yeah, I call it that. I coin this term the aha moments, and it really is so profound when you first come across that term. It's typically on in ways on social media when things begin to finally make sense. So great. Ashley, you want to talk about things next?
Yeah, so for me, like so many of us, I grew up feeling like my body was just so different from my friends and tried to understand why they had ankles and I didn't. I would joke with my closest friends that I felt like God cut my leg off at the calf and put a foot on it. And and then just struggled with that for years. It created issues with an eating disorder, trying to just fit the norm. And then as I got older, after having kids, it progressed into really affecting my mobility. And it was actually my husband that stumbled upon this term, lipedema. He's a nurse practitioner in May of 22. So I too, this is still, when I think about it, we're only 2 years into actually knowing about this, and it's been a life changer.
Yeah, it's pretty amazing. I remember that's when he actually found out about it.
Yes.
Which commonly goes on many times. The significant other or family member actually is the one to get on the internet and start doing research about things. Yeah. Allison, where are you? It looks like you're on the beach in Florida.
I'm on a boat.
On a boat, very nice.
I'm on a boat. I did blur the background, but it is a beautiful day here in Tampa, Florida. But yeah, so like a lot of us grew up. I always knew something was different. I always felt something was wrong with me, no matter how much I exercised or how much I ate. My thighs were always just bigger than the rest of me. And I grew up dancing. For those of you that might not know who I am, dancing was a huge part of my life growing up, and it has become a huge part of my life again when I downloaded TikTok in 2020 during the pandemic. I had recently found out that I had an eating disorder. I thought I just had to eat a certain way to fit, that society norm of what beauty looks like. And so as I started dancing on TikTok, I really had no plans for it to turn into anything. It was more just a contract I made with myself. I'm going to learn one dance a day. I'm going to move my body one dance a day. And people started following me. And it got to the point where I was getting so many comments and DMs and messages. Have you heard of lipedema? I think you have lipedema. I couldn't ignore it anymore. So I start Googling. I found Dr. Amron, and I researched a lot of doctors. But Dr. Amron, I just felt like, I don't know why. I was like, you are the one. And that's who I reached out to first for the diagnosis. And it took me, I would say, 2 years to really wrap my head around the fact that this is actually a disease. It took talking to Ashley and Sean on the Lipedema Mamas podcast to be like, whoa, like for it really to sink in. But yeah, that's my story.
So, so people are following you actually brought up the fact that I think you have lipedema.
It took, so 2020, I would say it was towards the end of 2020 and 2021 that it was like, I was starting to see it more and more. And at first when people were saying it, it would like trickle in like, I think you have lipedema. And I thought they were thinking like lymphedema. I was just very confused. But it got to the point where so many women were saying it. Like, I started Googling it, and when I saw the images pop up of lipedema bodies, I was like, whoa, that looks like me. But at that point, I wasn't experiencing pain, or at least I didn't think I was experiencing pain. And I didn't have varicose veins. You know, you look at like the textbook, this is what lipedema is. So I was like, this is just my body. It took a long time because after you diagnosed me, I went to a vascular surgeon and an endocrinologist, and they both told me it's not a thing.
Yeah, yeah. So I want to ask you, so, I've been involved many years in lipedema, and, finally things are really beginning to increase with awareness on the internet. And there really is such a community of, out there, and people are connecting. And I think it's mostly through the internet somehow and social media. I mean, certainly conferences like FDRS, you kind of really feel the power of the community. But how did each one of you get involved with the community? Ash, I want to begin with you with that, because I know you're such an educator with the community.
Yeah. Well, for me, when my husband brought me my phone that day and said, babe, look at this, and I found, these pictures of women with legs like mine, my world was turned upside down, and I didn't know that it was really in the best way. And so I started scouring the internet like we all do, and I went to Instagram, and one of the only accounts that I saw right in the beginning who would consistently post every day about her journey with lipedema was Sean Bigby, the Lipedema mama. And I had questions, and so I would just shoot my shot and like ask the question, and she actually responded back, and she and I began to kind of message back and forth. And I finally one day said, do you feel like there's a need for other pages out there to bring awareness to this? And she said, absolutely. And I kept feeling like I needed to make a page and just be open about my journey, but I did not want to. The last thing I wanted to do was put a picture of my ankles on the interwebs for everyone to see. But I did. And then messages just started pouring in from women like, oh my gosh, like, yes, that's me. And it just started this snowball effect in this community. It's kind of like when you become a mom, you realize that you are part of this club that you did not realize you weren't a part of until you're a mom, and so we just started making all of these connections, and it was mostly through social media, and it's been amazing.
You ladies are doing more to increase awareness than any other thing for lipedema right now. Do you realize that? I mean, any organization really, any other individuals, doctors, even our societies, you guys are really reaching out to women in such important ways. Kasey, how did you get involved with the community?
So, like Ashley, I was in that Google rabbit hole of looking for just answers and support. And it was both Ashley and Sean that I stumbled across first on social media that I felt like, okay, I understand this community a little bit. There are a few other groups on Facebook too, but I'll say those groups got really overwhelming really fast. But the way that I looked at it is I'm a journalist at heart. I am, as much as I hate the term, a social influencer. And I just knew that if I could share my story, maybe someone else would hear it and it would resonate with someone else, and it would be that voice that I was looking for. So for me, I felt like it was important for me to kind of be the voice within that community that I was looking for. So I just started sharing on social, and like so many of us just started getting this feedback of, wait, this is me, wait, that's what my legs look like, that's what my arms look like, that's what I feel. So I was grateful to be accepted into the community and also bring others along into it too.
Allison?
So very similar. The community really did come to me. Like, I'm so grateful.
Yeah.
It was because of the people messaging me and telling me that they thought I might have it, that I got the diagnosis from you. I didn't talk about it too much on socials at first, because I kind of felt like, I'm a mom dancing around my house in the pajamas. Like, what am I going to be talking about? I'm not a doctor. I was insecure to talk about it. But I made a video, and I think once I made the first video where I mentioned lipedema, that brought more people in the community kind of like to my page. And I think it was Sean that reached out from the Lipedema Mamas podcast with you, Ashley. Would I want to come on and just kind of talk about my story? And, Ashley, we talk about this so much. It was really one of the first episodes you did, right? There was technical difficulties, so we had to refilm it. And between the first time we filmed and the second time, I really started thinking a lot about like what you said, and what Sean said. And then in talking about it again, like it was through like you guys, and just socials in general that I got involved with the community.
Yeah. So what I've come to realize is, with your roles as luminaries, each of you really has a specific area that you're kind of more involved with things. And it's such a great thing. Kasey, yours is with early detection, right? And Ashley, yours is a lot with conservative therapies, and Allison, a lot of the mental health part of lipedema and eating disorders. We talked a lot about this. I mean, you actually, really made me realize how important it is to understand the role of mental health and eating disorders with lipedema and trigger words and all that stuff. So Kasey, why don't you talk about, your role with early detection?
Yeah, I just, the weight of it all and getting that diagnosis, I think it's kind of bittersweet, right? Where you have this moment of feeling like, okay, I have an answer. And then you look back and you're like, oh, I wish that 15-year-old Kasey had that same answer. And that just kept sticking with me, was the amount of body image issues, body dysmorphia, eating disorders, disordered eating that just comes along with lipedema that could potentially be alleviated and at least moderated or managed, just kept really resonating with me. So that's why I felt like that there weren't the resources for a younger generation. So that's why this month I launched Beyond Lipedema, which is geared towards millennials and younger. I feel like it's going to kind of almost be like a big sister, little sister program where we as lipedema patients can kind of help educate a younger generation to understand what those early detection signs are, why it's happening, how it's a hormonal trigger, it's genetic, it's not your fault, it's not that you're not doing enough or eating the right things. So I've created a brochure that I'd love to start seeing in gynecologist offices, pediatricians' offices, guidance counselors' offices in middle school, because those are the ones that the girls are coming into their office after gym class feeling so uncomfortable and so insecure. And rather than just having the one answer of, well, maybe eat less and move more, maybe it's this. And it could be something that they can bring to their primary care doctor to get a little bit more insight to. So that's really the goal, is showing kind of that you're not alone in this and you can manage it early on.
That is so well put. I cannot tell you how many times diagnosed women who are in their 50s or 60s. And, there's a certain relief to knowing that you have this disease, and there's a certain happiness to have a clear diagnosis, but there's also a sadness that many times goes on with this. And a lot of it is the feeling that, God, I wish I was diagnosed so many years earlier, because I could have had, that many years where I wasn't struggling with things or feeling shamed and blamed and all that stuff. And, the eating disorders that can start to develop with things. So early detection and diagnosis is really important. I've said the same thing. We've got to teach OBGYNs, pediatricians to diagnose it, to screen for it, really. I mean, why? It's such a common disease. About 1 in 9 or 10 women, we screen for diseases that are far less frequent. We should be screening for lipedema, right?
Yep.
So Ashley, why don't you talk about your role with conservative therapy and prevention?
So for me, and for Sean and I, the podcast has been such an amazing resource for women, connecting them to these trustworthy voices that can help them along their journey. And we knew, you know, like all of us, when we first got started, it took us years to wrap our mind around it, or weeks and months to figure out, okay, this is a thing. Well, then what do I do? And so we just wanted to create something that when people are just finding out about lipedema, they can go to and they can at their pace walk through how to manage it. And so we created this online course. We actually have two right now. One is a free mini course that answers two questions. What is lipedema? How do I get a diagnosis? Because those are the two most asked questions. And then our conservative therapy and conservative management course is just a deep dive into all of the ways that you can conservatively manage this disease, because we all know that whether we have surgery or not, conservative management will always be a part of life. Once you figure out you have lipedema, it is going to be a staple in life. And so and again, we wanted to connect the community with these trustworthy voices. So we brought on experts in their field to tell people about their lymphatics, about nutrition, about mental health, about all the things. And so we just wanted to help expedite that process so that women aren't left reeling and stuck and stagnant. We wanted to give them something that they could be, it could give them their power back and they could start being proactive, maybe a little sooner than like the rest of us. It took us a while, you know, so.
You are such an educator. You really are.
Awesome.
Well,
Yeah,
I
you are
was a
such
teacher.
absolutely.
Did you know that I was an
No,
elementary
I
teacher?
was actually going to ask you that. I mean, it wouldn't have surprised me if you came from a background of education.
Yeah,
So
yeah.
you're really
And
such an educator. It's great.
yeah, yeah.
So Allison, let's talk about you know, your kind of role as you feel it as a luminary, and you know, mental health and eating disorders, and you know, the
Yeah.
importance of hooking up with a therapist even.
Yeah. So even before, you know, my diagnosis with lipedema, I struggled, you know, with anxiety, depression at points in my life. But, you know, it all ties together because a lot of that came from, you know, just feeling like something was wrong with me, and, you know, the eating disorders and all of that. But one thing that really has come from, you know, the dancing and doing it every day is it just, every time I do it, I feel more confident, and I'm able to help other women feel more confident in their body because they're seeing somebody that's representative of what they look like. And they're like, well, maybe I can, if she can do it, maybe I can do it. And I think that that's really important because, you know, we didn't really have that growing up. We had, you know, Victoria's Secret angels. Like, so like Kasey had said earlier, like to be able to be that representation that we wish we could have had, I think is huge. And also to try to destigmatize talking about mental health and talking about eating disorders and talking about all of these things that so many of us struggle with, whether it's coming from, you know, a body image place or not. Like we all struggle, and it's so silly to not talk about that. And I also think it's so important to continue to share about seeking a therapist, because having a good mental health provider, especially when you get a diagnosis like this, as you navigate, you know, what is your journey going to look like? Because all of our journeys are different, you know, whether you have surgery or you're going to do your conservative therapies, it's so important to have somebody that can help you through, because it is this disease, it is not just physical, it is really, 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 really hard mentally. And going through the surgery, if you're having the surgery, especially, you know, if you've been battling eating disorders, you know, it's tough to wrap your head around the fact that you've worked so hard to love and accept your body as it is, but in order to take care of your body, you have to change it. Yeah. And to then not feel, you know, right after the surgery, I did feel like almost like bad, you know, like I felt bad.
Almost what?
I almost felt bad. Like it was a grieving kind of, like I felt bad, but at the same time, I felt such, as I have healed, I have felt such a renewed like gratitude for my body prior to the surgery. Every single day, my body showed up for me, and I did not realize everything my body had to do, because now doing these things, these dances, going up the stairs, going through amusement parks, it feels entirely different. So I don't know. I feel like that was kind of a long-winded answer, but I just think talking about mental health and talking about this is really important.
Yeah, I think it's a hugely important area. It's definitely one of my goals to, as we expand the scope of what we do in the ALT program, Roxburgh Institute, to bring in mental health support also.
Oh yeah.
I think mental health, is, challenged these days. I mean, kind of everybody, and definitely with the internet, just in people in general and younger girls, this and that, there's lots of studies that talk about this, and body image and eating disorders. And I think in the lipedema community, it's a higher percentage of women that are struggling with it. And I think that the support is not only important before surgery, even early with conservative measures, maybe preparing for surgery, but you actually just brought up a good point, maybe even after surgery too, because I talk about the surgeries being a life-changing transformation, and they really are, for people in terms of how they feel and how they look and all that stuff, but how they're dealing with the change in their bodies and how their mind is processing it. And is it accepting it, or is there a disconnect there? And so let's talk about that a little bit more. So afterwards, you kind of said you struggled with things after the surgery in terms of your new body. You felt bad,
right?
Or
I felt like almost like I can't think of the word. I'm struggling to find the word, but like I was going against my old body or something. There's a word for
cheating
it.
on it.
Like you cheated.
Yeah, I felt guilty about it too.
Right. And I think that that's something that so many women struggle with. And on top of that, like it's such a mental, it's so hard because it also, when women go through bariatric surgery, you have to go see a therapist. And my therapist was telling me, and I didn't know this, and it's really, really interesting. It takes your brain 6 months to catch up to dramatic changes with your body. And I'm like, wow. So it's like you're already feeling guilty. You're already having like trouble kind of like processing or seeing like what you actually look like in the mirror. Like it's a lot. It's a lot.
Yeah.
Well, I think, we could probably talk about this topic for a good hour
A long
itself.
time.
It's really interesting. There's so many different levels of it, but I think, it's maybe that feeling of the cheating, whatever it is, goes back to some of the blame that was kind of put on you even early on. Like, you're not doing your part of things. You need to do this. You haven't done this. Only if you do this. And that's kind of ingrained in you. So here it is, you're presented with something that is a change that you didn't really do yourself. And maybe that feels like cheating in a way too. I mean, it's important, I guess, to acknowledge that. My only concern, though, is that, and I've seen this actually in patients, that they don't acknowledge or accept that surgery is maybe necessary or an important step to a change in things. And they continue to advance and get worse. I've honestly seen in stage 3 and stage 4 patients, they still can't come to the grips with the need for surgery. And I'm careful about how I say that, because I don't want to be perceived like I'm trying to just have patients do more and more surgery.
No, I agree with you
the other
completely.
part of it, though, if they can't kind of break past that thing and do something that's actually important, it's setting this disease back, and it's progressing despite their best efforts. There's a cost to that also.
I think it's so important that we, and I know, Ashley, you're trying to talk. Like, I feel like showing the progression of what you're able to do, like as I'm healing more and more, it's just become so clear that this procedure is medically necessary. And I think that is such an important point to drive home. And Ashley, the floor is yours.
I just have to say, like, how I cannot more emphatically agree, because we talk with women all of the time who are now stage 3 and beyond. And they have been spending every waking moment of every day managing this thing. And for whatever reason, surgery just never came into the picture for them. And now they are where they are. They're very limited in their mobility. And this is where, for me, I don't feel like so much that like I was cheating on the mindset that I had to form prior to surgery, just in accepting my body. Where my tears come is that I'm so thankful that I was able to have this surgery. And I am so outraged that this surgery is not covered for everyone that needs it. That is where I get that's what
Angry?
I get upset about. Yes, because
Mhm.
it's, for me, we went to the beach a couple of weeks ago and the elevator broke and we were on the second floor. And I had to walk up and down those flights of stairs the whole few days that we were there. And every step I took, I kept thinking, if this were last year, I wouldn't have been able to do this. I would not have been able to engage with my family on a vacation, which is everyone's right to be able to do, because my legs could not have done it. I remember coming to LA and pulling my suitcase up a staircase at the airport because the escalator was out. I only made it halfway up and I had to stop because I could not lift my leg one more step. And this is where this is the motivation of everything that we do, is spreading awareness so that enough ears hear it to understand this has little to do with aesthetics and everything to do with mobility and health for women who should have that right.
Yeah,
Amen.
well,
Preach.
yeah, I agree. I just want to jump in for a second before Kasey talks about this, but I do see this a lot, and I kind of feel my role is to really try to help guide patients, and many times encourage them or kind of pull them past their fears or whatever anxiety with things, because it is so important. And I've seen many patients who have seen me for consultation, diagnosis, treatment plan, and they come back years later, and I mean years later, saying, I now want to do surgery. And I'm always curious, what made them wait and delay. And many times it's for many different reasons. Sometimes it's the feeling that, I thought I could do it myself. I thought I can go out there and just try more and diet and eat less and exercise more. And the disease has progressed. So now I actually say in those patients, especially if they're more rapid advancers, I finish by saying, I want to be very clear. It's very important for you to understand the importance of surgery. Whether it's with me or somebody else, and to understand, accept the role so that they're clear about that. Because I don't want to see those patients just go out and continue to progress and advance with things.
Yeah.
Kasey, why don't you talk about things?
Yeah, I think that for me, I looked at surgery as kind of like that reset button. I think I needed to manage my expectations going into it a little bit, like at first, because like we've all just said, I had this stigma. And I think that living in Los Angeles and saying that I'm going to get liposuction, the morning of my surgery, I can remember feeling this overwhelming sense of shame. And all I could picture was the scene from Legally Blonde where she wouldn't give her alibi because she said she was having liposuction. And she was just so embarrassed by it. And I think that it really wasn't until I came out of surgery that I looked down and I was like, oh my goodness, this is what my legs were supposed to look like. This is how my body was supposed to feel. And I think, kind of along the lines of what Allison was saying, like feeling this guilt and almost this shame and trying to catch my brain up to my body. And especially, the three of us are in a very influential social sphere where we put out this message of being so body positive or just trying to find this acceptance in our body. And then we go and do this, what can be sometimes perceived as like a cosmetic procedure. I had this major mind tug of war for me personally, where I was like, I felt guilty for doing this procedure, but I knew it was medically necessary. And, kind of to come full circle to Ashley's point is like, I wish there was more recognition for this disease, for the treatments for it, for the surgeries by the medical field and by the insurance industry, because then we wouldn't have that shame. And it would be just kind of an obvious, like, yeah, we know you have lipedema, you're going to go get this extraction surgery and then be done. Not done. We all know we're not done, but be done with that kind of, that feeling. So that's kind of where my mental tug of war was. And like that feeling, the name I gave it was really like guilt.
Yeah.
So I want to ask you, now that you guys have all been through the surgery, before and after, any advice you'd give to women in terms of consideration of surgery?
I think I would just say, you know, the surgery, it's not easy, but it is so worth it. And anyone that I've spoken to that has gone through the surgery with a good, reputable doctor, which is a whole other thing, you know, we can get into, has never said anything but it is life-changing. Like, it is worth it. You know, like get yourself through the first week or two, and you are going to live a life that you just never could have. I couldn't have ever imagined it, because I didn't feel it until afterwards. I didn't start to feel it until, you know, 3 or 4, like it's crazy to me. It's so crazy.
Yeah. Yeah.
Allison, when were how long ago were your surgeries? We finished
We
ago, right?
finished
Your last surgery?
what month are we in? June, December, January, February. End of February. So yeah.
So you're still recovering, you know,
right.
You know, you're a little bit slow to recover with things, but it's still improving. So, you know, you're not going to see your final results for about 6 to 12 months. It's going to continue to improve.
But I've seen
Ashley,
so much improvement already.
Yeah,
is all
absolutely.
I'm saying.
Ashley, any advice you'd give to women considering surgery?
I think I don't know. I think be your own best advocate and be brazen about finding a way. You know, I say that again very sensitively, because I know that financially, let's just put it out there, you know, like if my surgeries had not been covered by the med sharing company that we use, we would not have been able to afford it. But by God, I was going to find a way. And I will say that I say that to say that it is so beyond worth it, because now the contrast that I've experienced in my mobility, I did not realize how limited that I was prior to surgery. And I want that for anybody, for everybody, because the trajectory that I was on was the same as my grandmother. She spent the last 15 years of her life in a wheelchair, could not do the things that she wanted to do. And that's where I was headed. I was headed for that same chair, and now I'm not. And so find ways, ask questions, seek for resources. Don't take no for an answer. If somebody says no, hang up the phone, dial back up again and ask somebody else, and just seek a way to find it, to make it happen, because I can promise it is worth it. It is tough. A surgical recovery is never just a, walk in the park, but beyond worth it.
Kasey?
Yeah, I would say that like I said, managing your expectations going into surgery, I think that living in the Amazon 2-day shipping kind of culture that we do, I definitely went into it thinking I was going to wake up with these new legs and new arms and a new body, and be having all this body confidence, and all my body image issues and eating disorders magically went away too. You pulled that out with the liposuction too. But it doesn't. And I think that it's being prepared to do the work before, during, and after surgery. But I will say, and I've told this to so many women who are going through surgery, it is not nearly as intense as you build it up in your head. I remember being so nervous and so terrified about the anesthesia, about the recovery, feeling like I was not going to be able to move. And the fact that I was up and down stairs like the day after surgery was crazy to me. And all these different things that I just built up in my head didn't actually happen. So I try to make sure that everyone gets reassured it's not nearly as big as you think it is in your head. And honestly, as a mom, that twilight anesthesia was the best nap I needed. So it was all good.
Yeah, the twilight anesthesia, we didn't talk about that enough. The twilight anesthesia I was very nervous about, and it was nowhere near
No
as
big
scary
deal.
as I thought it was. And that,
Yeah.
yeah. And I'm
Shout
so
out to Courtney.
grateful. Yes, Courtney, we love you. I'm so grateful that I did do it this way because, to Kasey's point, like, got out of the car, like walked up to the, you know, like that day. It's like,
Right.
I was really pleasantly surprised.
Yeah. So for those listening that don't know, I mean, so they've all done surgery with me. My way of doing it is to avoid general anesthesia for so many reasons: safety, recovery, results. So it's done typically under twilight, but patients are essentially conscious. It's a conscious sedation. And so what they're referring to is every patient is nervous beforehand. I say this, it's almost the weirdos that are not nervous. They're, you know, it's just normal to be nervous about things.
They're the ones you got to worry
I'd be
about.
nervous going to a new thing, even though I've done it thousands of times. But virtually every patient says the exact same thing. It was so much easier than I thought it was going to be. I was so nervous before, and afterwards I was, you know what, I got this thing. It's really was so much easier than I thought it was going to be. I want to move on to another topic. So I did I don't know if all of you know this, I did a radio show about 10 years ago called A Cut Above. My co-host was Carrie Kasem, Kasey Kasem's daughter. It was on radio stations in Los Angeles for 2 years, and it was looking at cosmetic trends in cosmetic surgery. You know, my voice was to be a voice of reason and to guide patients, and I didn't like deceitful marketing and trends that I was seeing that were all about like the latest, greatest thing and selling procedures. It just really bothered me. It didn't sit right with me. And so I spoke about this a lot. I used to actually talk about the top 3 things that I saw the week before of his concerning trends. He's pulled magazine articles out and this and that. It still goes on. So with lipedema, you know, what advice can you give to women looking for treatment to get through all the noise that's going out there and decipher, you know, what is noise and what is really truth? I mean, you're very involved with that in the guidance you're doing for patients. So let's talk about that.
The first thing that comes to my mind is there are, as awareness spreads, there's going to be more and more companies and organizations and people come out of the woodwork. And we need to develop a filter for what is good and trustworthy and what we might need to be a little careful of. And I would say if any organization lands on slandering some doctors as opposed to others, be wary of that. And like, if you can find a place that gives you information and resources that is as unbiased as possible, but gives you facts, finding a surgeon in particular is such a personal and very multifaceted decision that you have to take into consideration so many different things and ask questions and know what outcomes you want and then go filter through that way. But we have to be careful about, you know, there is a lot of noise. And I think finding these pillars in the community that they've been here a while and their voice has been proven to be trustworthy and steady and unbiased, but trustworthy. I think finding those voices, which, you know, we're very picky on who we have on the podcast, and so you can start there if you want to. But I think just, you know, unfortunately, having to sift through some drama and some bad information is going to be part of it. But developing a really good filter for, okay, let me cut out the noise and let me get to, here's what I want out of my practitioner, out of my surgeon, out of the surgery itself, out of the aftercare, and filtering through it that way, if that makes sense.
Yeah, I think, again, really well put. I think that what I've always said is that lipedema patients, as opposed to maybe your average cosmetic patient, are what I call deep researchers. They
Yes.
generally want to learn and understand and get as much information as possible, which is a really good thing. There are certain patients that are very impulsive, that hear about something and are drawn to it. But, I agree, take your time, understand, slow things down. This is a very important decision, trusting somebody and kind of decipher all the noise out there. What else I want to say about that? Kasey, why don't you talk about that?
Yeah, I mean, Ashley, you made great points on kind of when you're looking for who you want your medical team and like your care team around lipedema to be. But I think it's worth noting that when we are now consumers on social media and getting heavily targeted, let's all just be real. The first time that you Google lipedema, every algorithm is going ding, 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 ding. We want you. We want you. So
Really?
I can remember.
That's going on with lipedema. All these algorithms are already.
Oh yeah.
Yeah. So as soon as you start following one of the three of us, there's a good chance you're going to start seeing a ton of lipedema content in your For You pages. But also when you start, when you're Googling these different things, and what really started to frustrate me, especially when I was first looking at things, are the brands out there that all of a sudden had this magical cure-all that was going to help lipedema. And, whether it be some sort of drink or some sort of lotion, or there's so many different things that I feel like as awareness comes around lipedema, that they're looking for those buzzwords, right? And just be mindful, find the resources that are really promoting the true conservative treatment methods, the true surgical methods, and don't just look for this kind of magic pill, because we all know there is no magic pill.
Yeah, I gotta what I was going to say earlier when Ashley was talking was she talked about trusted organizations, and I'm just going to give a plug for Lipedema Foundation.
Yes.
I mean, here's an example of a great organization. Felicity Dafter established it, and they are just doing such amazing work in research, real research work, and now work with awareness also. And I think they're doing a great job of being very unbiased, and they're very careful and smart how they go about doing things. Allison, what do you want to say about?
Well, yeah, to your point with Lipedema Foundation, they do have a lot of great resources on their website, and they're continuing to work on them. I'm a huge fan of Lipedema Foundation, but I would just, I think you guys really kind of hit most of my points. Just also, when you're looking for a surgeon, if you're, considering surgery, I would, if you could, educate yourself on all the different techniques that are primarily used, and really think about if general anesthesia or doing like a twilight type of sedation would work best for you, because that was like a big thing for me. And in reading your book, Dr. Amron has an incredible book, just by the way, that taught me so much. There you go, right?
It is really good. I think it's a very good guide to things.
It's very like impartial. Like he talks about all the different techniques that are utilized, general anesthesia versus twilight, the tightening things that you do, like with J plasma, Renuvion, all the things he talks about. But I didn't know that having lipedema makes you more susceptible to DVT, deep vein thrombosis. And I read that in your book, and I have a history of deep vein thrombosis. So for me, I really did not want to be put under general anesthesia. So there's just little things like that. And then I would also just really look and research, and that's what I did. Like I kind of narrowed it down to 5 doctors that I was interested in, and like, where did they get their training? How many years have they been doing liposuction, but specifically lipedema? Because I think it's also very important to note that cosmetic liposuction versus what we do, or what you do, not what I do, but what you do for lipedema reduction surgery they're two different methods. They're two different techniques. So you really need to make sure that whatever provider you are going to knows what they're doing. I think it's just really, really important to educate yourself about that.
There's a whole other topic I want to get into, but there are a lot of important considerations with lipedema surgery that's separated from just typical cosmetic liposuction surgery. You're dealing with disease, fibrosis, the risk of clot formation, decongestive therapy. I mean, that's why, I'll just say that, you really should ideally see someone who's very involved with it, and their whole center is really set up around it, not just dabbling in. Because there's a lot of, what I'm seeing is a lot of dabblers that are just now marketing for lipedema, and it's not really something they're dedicated to in terms of their practice. Okay, I want to get on to, because we got about 10 minutes left, some of the questions. We had so many questions that came in to us, so I wanted to be able to tackle at least, many of them with you. So let's start with this first question. There are no lipedema specialists in my area. I need help getting started. What do I do? So Ashley, any recommendations for that in terms of finding a specialist and
Yeah, so we do have that mini course available that you can take that answers what's lipedema, how do I get a diagnosis, where we show you how to use Lipedema Project's Find a Doctor tool. That is a tool that will show you all of the practitioners, not only surgeons, but just doctors, therapists worldwide that are available near your area. With that, though, so many people are going to find that when they use that tool, that there's not anybody very close by, that travel is going to be part of it. But what I want to say is that virtual consults are a thing, and they're fantastic. You can meet virtually with most doctors, and again, let it be someone who specializes in lipedema. My first consult was with a dabbler, and it did not go well, and I was misdiagnosed. And had my husband not been in the medical field, I would have run away with that diagnosis, and it would have been bad. So going to someone who really specializes in lipedema and utilizing that virtual aspect is really, it's an amazing thing.
Yeah, that really is true. I mean, there's so many resources. You can get diagnosed virtually. And I would also say, but obviously surgically, you can't do the surgery virtually. So
right,
you may have to travel for that. And again, this is not just a plug for me, but I will say that take your time to find that right surgeon. It's probably the most important decision you're going to make. And if it means getting on a plane and having to travel somewhere to get it done right, that's important versus just simply saying, I have to find somebody who is in my town with things.
Right.
So, any words about that, Allison?
No, I couldn't agree more. Like, you have one body, you're not shopping for a car. Like, you just really, and it took me 2 years, from the time you diagnosed me to be like, okay, I'm ready to have surgery. And I talked to quite a few, and I could have gone and seen, somebody in my backyard, but I wanted to see the best. So I came to you.
Kasey, anything to add to it in terms of guiding people, in terms of finding a specialist in their area, or not in their area, I guess?
Yeah, I think that the biggest thing is don't let that be the deterrent. Don't just don't sit on the sidelines because you're not in Los Angeles. Like for me, I was lucky enough, I live in LA, so I got to, a half-hour drive to go see Emily Eicher for my first diagnosis. And of course, depending on traffic, about an hour drive to go see you to get my second diagnosis and my consultation. So don't let that be the deterrent because virtual consultations and virtual diagnosis is just such an amazing first step in this whole world of lipedema.
I agree. Okay, another question. How can I help educate doctors on lipedema? I mean, this is an important one, but can be a tough one too, because doctors don't always want to listen. They think they know everything. So any advice on how you can help educate doctors on lipedema?
So I recently asked my husband about this. He's a nurse prac, and he will have patients come in often that have gone down the Google rabbit hole on whatever is ailing them. And I said, as a practitioner, like what is the best way for a patient to come in and kind of present something that's going on with them? And, I think for him, he was like, if they can have something in their hand that's reputable, that really helps, as opposed to saying, well, I looked up on Google. And that's where things like going in with things in your hand from the Lipedema Foundation, that, you know, can show them. Also, Lipedema Simplified has put out a research paper that they've been working the last several years on, and it is for both practitioners and patients alike. And I mean, it literally just, I mean, it's a couple of pages, and with a short glance, that doctor can go, oh, okay, well, and it's going to be a good filter too, because your practitioner is either going to say, maybe I've never heard of this, but let's put our heads together and see what we can do. Or if they're one of those that's like, oh, I didn't hear about it in medical school, there's your cue to go find somebody else.
Yeah.
You know, it's exactly right. I've said you know, when a patient mentions this to a doctor, they're going to find two different responses. One is that, you know, that's very interesting. I actually never heard about that. You know, thank you so much. You know, I really want to understand. They actually do. They'll go and look it up and say, you know, wow, I never knew of this disease. The other one, they're kind of giving you lip service. Oh, yeah, you know, okay. And they're just not going to bother looking it up. But, you know, I agree with you. It really helps to give them something, you know, or to direct them to resources.
Right.
So they can then look it up themselves. It's more likely they're going to respond positively with that.
Yeah.
Kasey,
Lipedema Foundation. Oh, sorry.
Go ahead, Allison. Go ahead.
I was just gonna say, Lipedema Foundation has like pamphlets. Like you can like literally like order these pamphlets and just give them out. I mean, I think
And they send them for free. They will send you however many you want for free.
Yeah, you know, I love these guys. You know, I see them all at the conferences. We talk together. Felicity and I joke about things, but they've got to love all the plugging that's going on for Lipedema Foundation.
I know, right?
I think it's a great organization. Absolutely, doing great work.
Yeah.
Kasey?
Yeah, just really quickly, that's my goal with Beyond Lipedema too, is having this brochure. It's a trifold. I'm getting the prototypes printed now, and then they'll be available too. So like a free download that is just a very digestible. Again, it's geared towards that younger generation. We know that they don't have time to be looking at it and be all overwhelmed by words. So there's graphics, there's quick little stats, and then on the back of it, there are little quotes from lipedema patients just kind of saying how they wish they were detected earlier, or just, you know, a little kind of, again, that sisterhood kind of comment on the back, commentary on the back. And then on the back, it's actually blank, where it says, use this space to create a list of questions to ask your doctor. So, you know, I want it to have that space that it becomes a conversation with their primary care.
Yeah.
You know, yeah, I was just thinking about this. You know, I did a post on social media about, you know, approaching somebody possibly that you may see in a supermarket or an airport that you know has lipedema, and that's an uncomfortable thing. And, you know, should somebody do that, it's a whole other discussion. But, you know, you have an opportunity here to change one person's life in a very positive way. But just think about this. If you make one doctor a believer, think how many lives that can change, right? You make one healthcare practitioner, a doctor, a believer.
I got chills.
And they're seeing 100 patients or 200 patients a week sometimes. And if lipedema is in 10% of the female population, they could be diagnosing potentially several women every week with lipedema and changing their lives. So how important is that? That's why we have to make the doctors aware of it. And not only that, and I've said this too, we have to teach it in medical schools. That's one of the biggest problems. That's one of the biggest problems. It's still not taught in medical school. And I've said this, you know, as doctors, you learn thousands of diseases in medical school. And when you never heard of it in medical school or taught of it, when you hear it years later, you kind of go back through your Rolodex of information, you know, and diseases. Oh, lipedema, I never heard about that. And then you've got a disease that's called lipedema that gets confused with lymphedema, and it just never stuck. So we've got to teach doctors, and as a patient, if you come with a doctor, you know, take an opportunity to make them aware about lipedema. You can change hundreds of women's lives with it.
Yeah.
Okay, let's move on to another topic, another big topic here. If you suspect, this is a question that came in, your daughter has lipedema, how would you help her? How would you make her aware of it? If this is hereditary, what information should I give my kids and grandchildren from getting it? Well, we know that really you can't just like not get it because it's genetic. If they can prevent it, what information should they have about it? So let's talk about this whole area here in terms of being a parent, having children, how do you maybe talk to them about lipedema if you suspect they maybe have it? What preventative measures should we put in place at that time?
Yeah.
I mean,
Ashley,
I can kick it off kind of. Oh, go ahead. Sorry,
Kasey, go ahead. Go ahead, Kasey.
I was gonna say I can just kick it off with like a quick little story because I have a 7-year-old daughter who, when I was going through my initial diagnosis and preparing for surgery, I can remember before I went into surgery, she would grab my legs and she'd go, "But I'm gonna miss your lippy legs." And she asked me, she's very inquisitive and too smart for her own good and all of our own good, for my, in my opinion. But she said, she's like, "Well, mommy, how do you get lipedema?" So I told her, well, it's genetic, either mommy or daddy, or a mommy or daddy have it. And, Grammy, my mom, now I know that she has it, just based on kind of the visual or the physical symptoms. So it's like, well, I got it from Grammy, and you might get it because you're half me, half daddy. And here's the best news, because I could see that look over her face, like, wait, so that means I'm going to have surgery and I'm going to have to be wrapped up and in compression. And I said, here's the good news, is that mommy has it. So I know exactly how to deal with it now, so that if when you get older and when you start going, as you get older and going through different changes, if we start seeing it in your body, we know exactly how to jump in and what kind of treatments to work around and what kind of lifestyle we need to do. And she just kind of looked at me. I know I used a lot of big words on her, and she's like, "Okay, so you have it, we'll both have it, and we can do it together." And I was like, "Yep, we'll just do it together." And it was so sweet. And I think that the answer to this really is just the more awareness and early detection, because then it's, and just kind of what the three of us are doing, right, is just showing these bodies out and about they look. And I always say, like, use us as the scapegoat. If you want to tell your daughter or someone that that you think they might have it, just casually bring it up and be like, "Hey, so I follow this girl on Instagram and she figured out that she has this disease, and it's actually what caused her thighs and her arms to look so much bigger than the rest of her body." Like, and you start the conversation that way and make it super casual, and let us do the rest of the work for you.
Yes. Yeah. And I want to say too, I think this is where it's so important, because so many of us have lived in shame for so long and we didn't talk about it. We hid, we wore blue jeans in summer, that this is where we've got to, some of the biggest steps for some of us are going to be just having the conversation with our spouse and with our family and making them aware. Because now, my kids will come up and be like, they'll whisper like, "Mommy, do you think that lady has lipedema?" And I'm like, "Let's talk about it here in a little bit." But Charlie, my daughter, she's 5. She sees mama jumping on the rebounder. She sees mama wearing compression. We talk about it, and it's not lipedema is not a bad word in our house. It's just part of life. It's just something that we deal with. And so I know that as she gets older, if it shows up in her, she's going to already have years of security knowing, I've watched mama deal with this. It's okay. And I'll say this too. Last summer, when I was going through all of my surgeries, she had an appointment with her pediatrician. I took time out in that appointment to tell her pediatrician all about what I was going through. And the pediatrician in that appointment put lipedema in her chart as something to monitor her for. And that, it's just it's just those sort of things, just being open enough, even though I know, we don't want to always talk about it, but if we'll just get over that shame hurdle a little bit, it's amazing the walls that it will break down and the lives that it can change.
Ashley talking about making it normal. My daughter now wants to be a fashion designer, and she told me that in her store, she's going to have pants and shirts for lipedema that will have bigger legs and smaller waists and bigger arms. I was like, "Girl, I will get your marketing done." I'm so excited.
That's awesome.
Allison?
So I don't have daughters. I have 2 little boys. My youngest is super inquisitive. And so he's similarly to Kasey. He was like afraid that I was going to lose like my lippy legs. Like he loves my lippy legs. But he was asking, can boys get it? He was like, and so it brought up a whole conversation, and again, similar to what you guys have said, being able to watch and see that it's not like the end of the world. It's not like a lipedema diagnosis there's answers now, but it is, for people that don't know, males can't you can talk about that more. I don't know how much you want to get into it. I know we're like out of time, but yes, it's just more rare.
So did you answer him when he asked that question? Can boys get it?
Yeah, I did. I said boys can get it. It's much more rare for boys to get it. I said it's possible that you even could carry the gene and never express symptoms. Like
right.
That's how it works.
Yeah, it's a tough thing to, first thing is when to talk about it. And I think especially with girls, even more than boys.
Right.
And then how. I mean, as people hopefully know, it's a genetic condition. It is passed down from a parent, either a mother or father, and there's a 50% chance of that gene being passed down. So it's literally like a flip of a coin, that if a mother has it, that 50% chance of a boy or girl getting the gene. The boy won't generally express it. The girl will begin to usually express it beginning around puberty. So, it's a tough one. If you've got a 5-year-old daughter and she's seeing mommy has the condition, and she asks that question, am I going to get it? It's a tough thing, to even sometimes answer it. And the possibility is I guess, a fair answer to that. You're not going to necessarily diagnose it at age 5, even clinically. There's no test for it. There may be subtle signs of it, but usually not. It will begin to manifest itself at puberty. So, I think that, maybe it's not the best to bring it up early on and create that worry and fear about things. Only when maybe it begins to present, there's a discussion about things. And then I think at that point, the daughter is taken in for a proper diagnosis. There's a discussion about this condition. And then the preventative measures start. What do you think about that, what I just said?
No, I almost
Kasey?
think that kind of what we were saying about normalizing it, right? If you don't make it seem like, oh, I have to do this because I have lipedema. More like Ashley's point, I get to bounce around because I have lipedema. It's kind of making.
Uh-oh. Did you leave her?
No.
Oh, no.
Oh, my
Well,
goodness.
maybe I think though, I can catch on to what she was saying, just normalizing it. Like Charlie, my daughter has not yet asked me, am I going to have it? She's not asked that question. But, I know that in parenting, a lot of times most is caught rather than taught. So our kids pick up on things that we're not actually looking them in the eye and talking to them about. Oh, hey, Kasey. So normalizing it. Keep going, sis. She there?
Kasey, you with us?
She's trying. So
can you hear me? Kasey, can you hear me?
I don't think she can.
I want to ask a really sensitive question. Because it's a whole nother level I kind of wonder about as a parent, if you've got a condition that's genetic, that may be passed to your child, is there a sense of, I'm not sure what word to use, guilt or something about that there's another level of.
Sorry, I dropped off, but
you're not only struggling with the fact you've got a condition yourself, but that you may pass this on to your child too, and how that feels.
Yeah. It's for me, I deal with fear over it just because I know how much it impacted me at an early age. And let's face it, being a teenager is no more easy these days than it was when we were teenagers. And so I worry about that, but I can't sit too long in a guilt, pool about it, because I can't help that it was given to me and that I was born with it. And so I just more think of it from when I'm parenting Charlie today. I am trying to instill things in her self-confidence that will carry through when she's a teenager, when she's going through puberty, that will hopefully give her some solid ground to stand on, that even if she has lipedema, she's going to be confident. Because I didn't have that. I just wasn't a very confident person to begin with. So that's just kind of where I go with things.
Yeah, I think that body image is really taking that shift, thank goodness, because they're, you know, to your point, like I look at my daughter and she's such a tiny little beanpole peanut, but I'll look at like her knees and I'm like, do I see a little pocket like developing around her knees? And I definitely feel that like concern, and but I think it's more of a, I realize it's more of a me thing. It's more of me worrying that she might have some sort of insecurity, but if I do the work and reverse that on me, then hopefully she won't absorb it, because I feel like we all kind of absorb it from our surroundings, right?
Yes. Yeah. And Charlie does not hear me talk about wanting to be thin, wanting to be skinny. We talk about being strong and healthy in our house. And we are beautiful with makeup, without makeup, in grubby clothes, in a beautiful dress. Like those are the things that I think are the scaffolding to help these babies. If they do end up having it, they're going to have more of a foundation of confidence to stand on, that I think will just help,
Yeah, I think we're doing the work to remove the shame around it.
Yes. Yeah.
Great, well put. Well, I think son is calling me here always. We are out of time. We have gone over time, and it's been such an amazing thing talking with all of you guys. And I want to really acknowledge and thank you for being so involved in increasing education awareness for lipedema, because you're really doing amazing work. You are changing the lives of so many women. And I want to thank all of you for tuning in to another episode of Lippy Logic. And we will be having another one about a month or two from now. Thank you so much. And tune into our next episode, okay? God bless. Thank you all.
Thanks, everyone.
Bye. Thank you.